Getting ready to welcome a baby boy into the family is an exciting time for any mom and dad.
But when the baby arrives 14 weeks before his due date and so small that even these preemie pajamas are too big, the excitement can quickly turn into unbearable fear and worry.
Meet Camarion, a little one who came into the world very early and faced great odds.
Well, I didn't have anything that made me notice that I was having problems. I was just at work and my water broke. So.
The neonatal intensive care unit here at Wishard primarily provides care for newborns who are born at risk and high-risk infants here. As such, this is primarily premature newborns and babies with respiratory compromise noted shortly after birth. Camarion was born at about 14 weeks early, and as such, he had some of the typical problems associated with premature newborn.
His lungs were underdeveloped, his intestinal system was underdeveloped, so he needed a little bit of a boost with our CPAP, continuous positive air pressure, to breathe. He had IVs, was on antibiotics.
When I first saw him, I was more scared than anything. But whenever the nurse actually showed him to me, and I was thinking that his eyes would still be fused and, you know, he just wouldn't look like a baby, you know. But of course, there he was, and his eyes were big and bright, and he was actually looking at me. So, you know, that was like the best thing, the best feeling that anybody can have, having a baby at 25 weeks. Can you imagine just holding a baby like this in your hands?
It's a roller coaster ride for a premature infant, and we ride it right along with the parents. Camarion's mom has been very, very, very involved from the very beginning. She's here every day, spends a lot of time with him, asks a lot of questions, participates as much as she can in his care.
I went to the hospital every day for 4 months, every day. I never missed a day. I would get off work at 4:30, go straight to the hospital, and I would stay until like 11 o'clock that night. So, and that was every day for 4 months. On April 7th, which was his due date, I came in and they just told me that he could come home, and that was just the feeling, God, not going to the hospital no more, you know, and having him home and knowing I can go to sleep with him in the same room and, you know, be there. It was a wonderful feeling.
When the babies leave our Wishard NICU, they're going to their home and they're leaving our home, and we do miss them and we miss the parents.
To feel that at the end of the day we have impacted positively that patient and those other patients, along with the ones that delivered, the ones that came into our unit briefly, and then those families, is all that you can ask for. It's fantastic, and I love it.
Thank you for the support, being there whenever I really needed someone to talk to. Thanks for reassuring me that my son will be okay.